Okay. Now, the skin test is not conclusive of the Mycobacterium tuberculosis active infection. So that's why sputum microscopy is still the most practical method. Okay. So before we can even test for mycobacteria, we need the right specimen. Okay. The most common is the sputum. Okay, which is collected no, in the early morning for 3 consecutive days. So question, why morning? Because secretions accumulate overnight, which gives us the highest yield of the bacteria. So collecting early morning sputum 3 days in a row increases the chances of catching Mycobacterium tuberculosis under the microscope. Okay, so sputum, right, is a mixture of mucus. Okay, take note, immune cells, the bacteria, or sometimes even fungi. Okay, with the pus cells or the WBCs, and sometimes blood. These are all produced in the lungs and lower airways. So our sputum sample should be it can either be purulent, no, it can be mucoid or even blood stained. No, sometimes ang blood stain na produce siya whenever kapag may nasugatan na yung airway or kaya yung may mga holes na na-create sa lungs, no, kaya nagkakaroon ng blood na specimen or na sputum. While saliva is a clear, watery, no, and comes from the mouth, while the sputum is thicker, no, often ang color niya is yellow or sometimes green or sometimes bloody, and it originates deeper in the respiratory system. Now, saliva, take note, has limited diagnostic value as it mainly reflects oral health. No, while sputum provides a direct window into lung and airway conditions. That's why sputum, no, is the sputum test procedure is a cornerstone of diagnosing respiratory diseases through laboratory analysis. Now, accurate sputum sample collection is essential to avoid false negative or mga inconclusive results that could delay treatment or lead to inappropriate care. So by ensuring a clean, adequate sample, patients and doctors contribute to the better treatment outcomes. Okay? So importante na mabigyan talaga ng instructions yung patient to have or to acquire a specimen no, of a good quality na specimen, hindi lang yung laway, no, as much as possible. We reject no salivary specimens in the laboratory. Okay, though there are times na very rare lang na time no na may tendency pa rin na positive for the Mycobacterium tuberculosis ang salivary, but however again napaka konting chance nito to really acquire that kind of good result. Okay, so again no kailangan ng good quality specimen sa laboratory no for us to determine or detect the Mycobacterium tuberculosis. Okay, now gum staining for Mycobacterium tuberculosis won't work. Okay? Because their cell wall is like a wax raincoat. Diba? Remember, sa ito ilang cell wall? The mycolic acid. Okay? This dye no ng mga gram stain just slip off no to their cell wall. Instead, we use the acid fast staining. Now the acid fast staining can either be two methods no it can be Quinion or kaya Ziehl-Nielsen. Okay, now the Ziehl-Nielsen, all right, is a hot method wherein it uses carbolfuchsin as the primary stain plus the presence of heat or it is applied with heat no. So habang ginabutang nimo ang carbolfuchsin sa smear sa slide, you add heat no to the stain so that mas mapa-enhance no, the heat will serve as the mordant wherein it enhances the affinity of the primary stain to the cell wall no of the bacteria. After that, you applied acid alcohol which serves as the decolorizing agent, and then followed by a methylene blue which is a counter stain. Okay, all right. Now, with the Quinion acid fast stain method, no, this is a cold stain. The same gyapon siya principle with the Ziehl-Nielsen without lang siya, wala lang siya gi-apply na heat. Okay, so it has carbolfuchsin, acid alcohol, and methylene blue. Compared with the Ziehl-Nielsen, na gi-add na heat no as the mordant. Okay, now the acid fast bacilli, okay, acid fast positive bacilli takes up the counter the primary stain, the carbolfuchsin. Okay, so since nag-take up siya, no, gi-take up niya ang carbolfuchsin with the presence of heat, no, na-enhance ang pag 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 pagsulod sa primary stain dito sa cell wall sa bacteria. Okay, Now, since ang cell wall ng Mycobacterium, okay, is mycolic acid which is resistant to acid alcohol, so wala niya na remove no ang count ang I mean ang primary stain, so nag-take up lang niya ang primary stain. So when the methylene blue or the counter stain is added no to this smear, no, the bacteria will not appear as blue, it will appear as red. Okay, now compared with the acid fast negative na bacteria, okay, so since it doesn't have a mycolic acid, no, so with the presence of the decolorizer, na-remove ang carbaalfuchsin, no, ang primary stain. So that's why na-take up niya ang counter stain na methylene blue. Okay, so take note of the two, no. So kapag acid fast bacilli, they are rods, they are slender, na mga payat, okay, na mga bacteria or mga bacilli, and they are red. They are acid fast. So remember na ako before, okay, so, di ba kayo naman to'y cartoon na mga sakyanan, di ba, mga fast cars sila. So ang kuan dito, ang bida dito kay katong color red. So acid fast, they are red, no, in staining. So the number of specimens necessary to obtain culture confirmation and perform susceptibility testing is related to the frequency of the smear positivity. Di ba remember, tulo ka buok ang isubmit dapat sa patient na specimen, okay? So before that, no, kailangan sa siya i-test for direct sputum smear microscopy or the DSSM, okay? So you perform a smear, no, for the sputum wherein na siya requirement na size or standard sa ihang size. So ihang size standard sa smear for the acid fast na stain or na smear, I mean acid fast smear, is ang width niya is 2 cm and then ang ihang length is 3 cm. Okay? Of oval siya or oblong na shape, no. Again, ang iyahang size is 2 cm width and then ang iyahang length is 3 cm width. Now here is the rules, no, for us to report the positivity of the smear since tulo ka buok iyahang specimen na isubmit, no. At least 2/3, okay, 2 out of 3, okay, of the smears are positive, which this will confirm the diagnosis for Mycobacterium tuberculosis. Okay? If 2 out of 3 specimens, no, sa ihang smear is nag-positive siya, na nakita na Mycobacterium tuberculosis, which is color red, no, mga rods and slender rods, okay, so it can already confirm diagnosis for Mycobacterium tuberculosis. Now, if the specimen, no, out of 3 walay nakita or kaya nay isa, okay, no, 0 to 1, no, out of 3 specimen nag-positive. Okay, so masking isa kas sample lang out of 3 nag-positive or kaya wala ni isa sa ilaha nag-positive, okay, it needs culture for confirmation. Still, the gold standard is the culture, alright, for confirmation. Okay, another microscopy or staining na method to diagnose Mycobacterium tuberculosis is the phytauramine rhodamine, okay, or the Truwant fluorochrome. Alright, so this is the most sensitive microscopic technique. Okay, so this is my favorite in the laboratory. Maski wala pa na ako ni siya na experience, pero tanawon ako siya kay wow, amazing gid kayo kay dili ra kay nimo siya makita, no, but it requires dark field microscopy, a fluorescent na microscope. So this demonstrate the presence of acid bacilli, acid fast bacilli. So when the cells are observed under an ultraviolet light, they appear bright yellow, green, no, or kaya mga orange. Okay, so still confirmation gihapon siya by culture methods. Required gihapon siya since positive or negative staining gives presumptive gihapon na results. So most stains of rapid growers may not appear in the fluorescent microscope. Alright, so negative fluorescence should be confirmed with the Ziehl-Neelsen stain. Again, negative fluorescence, no, of this method should be confirmed with the Ziehl-Neelsen stain. These dyes, mga auramine and rhodamine, are possibly carcinogenic. So these